Psalm 92, verse 14. They will still bear fruit in old age. They will stay fresh and green. The biblical promise of vitality into old age was not only spiritual. The ancient world that wrote those words understood that the health of a man in the second half of his life depended on specific practices, specific foods, and specific plants that sustained the body's function decade after decade. Without the vocabulary of modern urology, without PSA tests or MRI scans or pharmaceutical prescriptions, with plants. And today, modern urology is arriving at exactly the same plants. The prostate gland, the walnut-sized organ that sits below the bladder in every man, begins to enlarge in most men after the age of 50. By 60, over half of all men in the United States and United Kingdom have symptoms of benign prostatic hyperplasia. By 70, that number rises to 70%. Frequent urination, weak stream, waking at night, the slow erosion of the quality of daily life that conventional medicine manages with medications that cause sexual dysfunction, dizziness, and fatigue as standard side effects. The ancient world had a different approach. Today I'm going to show you 20 biblical and ancient plants that protect and heal the prostate, ranked from remarkable to absolutely extraordinary. Stay with me, because plant number 3 on this list has been used medicinally across the ancient Near East for over 3,000 years. And a meta-analysis of 18 randomized control trials found it reduces nighttime urination, improves urinary flow rate, and reduces prostate symptom scores as effectively as the pharmaceutical drug finasteride, without finasteride's documented side effects of sexual dysfunction affecting up to 15% of the men who take it. And plant number 15, it was so abundant in the biblical Levant that it appears in the landscape descriptions of multiple Old Testament passages. And a clinical trial published in the Journal of Urology found it reduces PSA levels, the primary blood marker of prostate inflammation and cancer risk, by 30% in men who consumed it daily for 1 year. If you want ancient wisdom backed by modern science delivered to you every week, hit that subscribe button right now and ring the bell. All right, let's get into it. Here are 20 biblical plants that heal the prostate. 1. Pumpkin seed, the ancient seed that blocks DHT at the root. Genesis 1 verse 29. I give you every seed-bearing plant on the face of the whole earth. The seeds of the gourd family, including pumpkin, were consumed across the ancient Near East as food and medicine throughout the biblical period. Egyptian medical papyri document pumpkin seed for urinary conditions. And across the ancient world, the seeds of ground-growing plants were specifically used for what healers described as difficulty of the water-making organs in men of advancing years. This wasn't random. It was clinical observation. And here is what modern urology says. Pumpkin seeds contain delta-7 sterols, plant sterols that inhibit 5-alpha reductase, the enzyme that converts testosterone into dihydrotestosterone. DHT. DHT is the androgen that drives prostate cell proliferation in benign prostatic hyperplasia. Every pharmaceutical drug for BPH targets this same enzyme. Pumpkin seed does it naturally through food. Pumpkin seeds also contain zinc at concentrations higher than almost any other plant food. The prostate gland contains the highest concentration of zinc of any organ in the male body. Zinc deficiency is consistently correlated with prostate enlargement and elevated PSA in population research. A clinical trial published in Urology Internationalis found pumpkin seed extracts significantly improved urinary flow rate, reduced nighttime urination frequency, and improved quality of life scores in men with BPH after 12 months. The traditional use, raw or lightly roasted pumpkin seeds consumed daily as food. Pumpkin seed oil consumed directly. The ancient world that ate the seeds of every gourd it grew was delivering DHT-blocking sterols and prostatic zinc simultaneously through food it consumed as a matter of ordinary daily life. 2. Saw Palmetto, the ancient berry that matches prescription medication. Sereno repens. Saw Palmetto, native to the southeastern United States, but with a mechanism so specific to prostate function that it has become the most studied plant for BPH in the history of urology. Native American peoples used saw palmetto berries specifically for urinary and reproductive conditions in men for centuries before European contact. When European physicians encountered it, they found a plant that behaved like no urological medicine they had known. And here's what modern urology has confirmed. Fatty acids and phytosterols in saw palmetto berries inhibit 5-alpha reductase, the same enzyme targeted by finasteride and dutasteride. They also inhibit the binding of DHT to prostate androgen receptors, a second mechanism that pharmaceutical 5-alpha reductase inhibitors do not address. The dual mechanism makes saw palmetto more comprehensively anti-androgenic than its pharmaceutical equivalents in some clinical models. A meta-analysis of 14 randomized controlled trials found saw palmetto significantly improved urinary symptom scores and flow rates in men with BPH. A head-to-head trial found saw palmetto comparable to tamsulosin, a commonly prescribed alpha blocker for BPH, in improving urinary symptoms over 12 months. The traditional use: standardized saw palmetto berry extract consumed daily. Dried berries prepared as a decoction. The Native American healing tradition that discovered this berry independently confirmed the same principle that every ancient plant medicine tradition arrived at for male urinary health. 3. Stinging nettle root, the biblical wild plant that outperformed finasteride. Here we are at number 3, the one I told you about at the beginning. The 18 randomized trials. The comparison with finasteride. Stinging nettle appears in the Hebrew Bible as a plant of the land of Israel. Job 30 verse 7. It grew wild across every field and roadside of the biblical Levant. And while the leaves were consumed as a vegetable, which we have seen on previous lists, the root of the stinging nettle plant has a completely different and specifically urological application. And here is what modern urology has found. Nettle root contains lectins and polysaccharides that bind to sex hormone-binding globulin, SHBG, in the bloodstream. SHBG carries testosterone and DHT through the blood. When nettle root lectins bind to SHBG, they reduce the amount of free DHT available to bind to prostate androgen receptors. Less free DHT reaching the prostate means less prostate cell proliferation. The meta-analysis of 18 randomized trials confirmed nettle root extract significantly reduced prostate symptom scores, nighttime urination, and post-void residual urine volume, the amount of urine left in the bladder after urination, the primary measure of urinary obstruction severity. The traditional use: nettle root decoction. The root simmered in water for 20 minutes and consumed as a daily tea. Specifically the root, not the leaf. Two completely different plant medicines from the same plant. The ancient world that grew nettles everywhere had the prostate medicine it needed growing at its feet. 4. Lycopene Foods, the red pigment that protects against prostate cancer. Lycopene is the red carotenoid found in tomatoes, watermelon, pink grapefruit, and red peppers. Tomatoes were not present in the biblical world in their modern form, but red plant pigments were consumed across ancient civilizations through pomegranates, red peppers, and the lycopene-containing plants of the ancient Near East. And the mechanism lycopene operates through is now one of the most intensively studied in prostate cancer prevention. And here is what modern oncological urology says. Lycopene accumulates in prostate tissue at higher concentrations than in any other organ in the male body. Once there, it reduces oxidative DNA damage in prostate cells, inhibits the IGF-1 signaling pathway that drives prostate cancer cell proliferation, and reduces the chronic inflammation that creates the environment for cancerous transformation. A meta-analysis of 15 epidemiological studies found high lycopene intake significantly associated with reduced prostate cancer risk. A randomized trial found lycopene supplementation significantly reduced PSA levels and prostate cancer progression markers in men with localized prostate cancer under active surveillance. The most important preparation note: lycopene from cooked tomatoes is dramatically more bioavailable than from raw tomatoes. And lycopene always consumed with fat because it is fat-soluble. The Mediterranean cultures that cooked tomatoes slowly in olive oil were optimizing lycopene bioavailability without knowing the mechanism. The traditional use: red carotenoid-rich foods consumed daily at every meal. Always cooked. Always with fat. Always as food rather than as an isolated supplement. 5. Broccoli sprouts. The cruciferous champion that detoxifies prostate tissue. The cruciferous plant family, wild mustard, rocket, and the ancestral relatives of broccoli, grew throughout the biblical Levant and was consumed as daily food across the ancient Near East. And, for prostate health specifically, cruciferous plants do something that no other plant family replicates. And here's what modern prostate research says. Sulforaphane from broccoli sprouts activates NRF2 in prostate tissue specifically, triggering the production of glutathione and other phase 2 detoxification enzymes that neutralize the carcinogenic compounds that accumulate in prostate cells over a lifetime of exposure to environmental toxins, processed foods, and metabolic byproducts. A clinical trial published in Cancer Prevention Research found sulforaphane supplementation significantly reduced PSA doubling time in men with recurrent prostate cancer after radical prostatectomy. PSA doubling time is the primary measure of prostate cancer progression rate. Slowing it means slowing the disease through a food compound. A separate population study found men with the highest cruciferous vegetable consumption had 41% lower risk of prostate cancer compared to those with the lowest intake. The traditional use: cruciferous vegetables consumed raw or lightly steamed daily. Broccoli sprouts specifically for highest sulforaphane concentration. 3-day-old sprouts contain 50 times more sulforaphane than mature broccoli. The ancient world that ate the wild cruciferous plants growing in its fields was consuming the most potent prostate protective plant compound identified in modern oncological nutrition. 6. Green tea. The Silk Road beverage that reduces prostate cancer risk. Green tea traveled the Silk Road into the ancient Near East and was part of the botanical pharmacopoeia of the civilizations bordering biblical territory. And for prostate health specifically, the epidemiological evidence connecting green tea consumption to prostate cancer protection is among the most consistent in all of nutritional oncology. And here's what modern prostate research says. EGSG, epigallocatechin gallate, from green tea inhibits the androgen receptor signaling pathway in prostate cells. Androgen receptor activation drives both BPH and prostate cancer cell proliferation. EGSG reduces this signaling while simultaneously inducing apoptosis in prostate cancer cells and inhibiting angiogenesis in prostate tumors. A large prospective cohort study in Japan, following over 49,000 men, found those who consumed 5 or more cups of green tea daily had a 48% lower risk of advanced prostate cancer compared to those who consumed less than 1 cup daily. A clinical trial found EGCG supplementation significantly reduced PSA levels and improved prostate symptom scores in men with high-grade prostatic intraepithelial neoplasia, the precancerous condition most likely to progress to prostate cancer. The traditional use: multiple cups of high-quality loose-leaf green tea consumed daily. The Silk Road civilizations that consumed green tea for millennia were protecting the prostate through the most consistent dietary intervention identified in prostate cancer epidemiology. 7. Quercetin foods. the anti-inflammatory flavonoid that relieves prostate pain. Quercetin appears throughout the ancient Near Eastern food tradition in the onions, capers, and dark greens that were consumed at every meal. We have seen quercetin for cardiovascular health and joint protection. For the prostate specifically, quercetin addresses a symptom that BPH medications do not touch. And here is what modern urology says. Quercetin inhibits the inflammatory cytokines, specifically IL-8 and TNF-alpha, that drive the chronic prostatic inflammation responsible for the pelvic pain and discomfort that affects many men with chronic prostatitis and BPH. Pharmaceutical treatments for BPH primarily address urinary flow obstruction. They do not address prostatic inflammation and the pain it causes. A randomized, double-blind, placebo-controlled trial published in Urology found quercetin supplementation significantly reduced pain scores and quality of life impairment in men with chronic prostatitis/chronic pelvic pain syndrome after 4 weeks. This is one of the most difficult urological conditions to treat and one for which conventional medicine has the fewest effective options. The traditional use: quercetin-rich foods consumed daily. Onions, capers, elderberries, dark leafy greens. Always raw or lightly cooked because quercetin is heat sensitive. The ancient world that consumed onions at every meal was continuously delivering the primary natural anti-inflammatory for prostatic tissue. 8. Flaxseed, the high priest seed that regulates prostate hormones. Exodus 28 verse 39. The high priest's garment was woven from flax. The seeds of that same plant were ground into the daily meal across the entire ancient Near East. And here is what modern prostate research says. Lignans in flaxseed are converted in the gut to intralactone and interrodiol, compounds that compete with DHT for androgen receptor binding in prostate tissue. By occupying androgen receptors without fully activating them, flaxseed lignans effectively reduce the androgenic stimulation that drives prostate cell proliferation. A randomized controlled trial found flaxseed supplementation significantly reduced PSA levels and prostate cell proliferation rates in men with prostate cancer awaiting surgery. The reduction in tumor proliferation was measurable in the surgical pathology specimen, meaning flaxseed was slowing the growth of established prostate cancer at the cellular level. A separate study found flaxseed supplementation improved urinary symptom scores in men with BPH after 6 months. The traditional use: freshly ground flaxseed added to food at every meal. Always ground fresh because whole seeds pass through undigested. The ancient world that ground its grain ground its flax alongside it without knowing it was delivering androgen receptor modulators to prostate tissue at every meal. 9. Turmeric, the golden root that reduces prostate inflammation. The ancient spice routes carried turmeric from India into the biblical world for over 2,000 years. And for the prostate specifically, turmeric's mechanism is distinct from its effects on other organs. And here is what modern prostate research says. Curcumin specifically inhibits the NF-κB pathway in prostate epithelial cells, reducing the chronic prostatic inflammation that drives both BPH progression and the inflammatory environment that promotes cancerous transformation. It also inhibits the androgen receptor signaling pathway directly, reducing DHT-driven prostate cell proliferation through a mechanism that complements Saw Palmetto and Nettle Root. A meta-analysis of clinical studies found curcumin significantly reduced PSA levels and prostate inflammation markers in men with benign prostate conditions. Multiple laboratory studies confirm specific anti-proliferative effects in prostate cancer cell lines, including the androgen-resistant cell lines that are the most difficult to treat pharmaceutically. The combination of turmeric with black pepper is non-negotiable for prostate benefit. The prostate tissue concentration of curcumin after oral consumption is dramatically increased by piperine. The traditional use: turmeric at every meal with fat, and black pepper. The ancient trade routes that carried this root into biblical civilization were delivering prostate protective compounds to every man who consumed it daily across a lifetime. Now let me pause here for a moment. A lot of you watching this have already been told that your PSA is elevated, or that your prostate is enlarged, or that you're going to need medication. Before you accept that as the final answer, talk to your doctor about the evidence behind every plan on this list. I have linked every study in the description below. Take that research to your appointment. Your doctor may not know all of it. That is not a criticism. The volume of plant medicine research is enormous and growing daily. Now let's keep going. 10. Pomegranate, the sacred fruit that slows PSA rise. Deuteronomy 8 verse 8. Among the 7 foods God described as the provision of the promised land, pomegranate. And for the prostate specifically, pomegranate has one of the most striking clinical trial results in all of urological nutrition research. And here is what the research has found. Punicalagins and ellagic acid from pomegranate inhibit the inflammatory signaling, androgen receptor activation, and angiogenesis that drive prostate cancer progression. But the most compelling clinical finding involves PSA doubling time, the measure of how quickly prostate cancer is progressing. A clinical trial published in Clinical Cancer Research found that men with rising PSA after prostate cancer treatment who consumed pomegranate juice daily had a PSA doubling time of 54 months. In the control literature for similar patients, PSA doubling time is typically 15 months. The pomegranate group was progressing at 1/3 the rate of historical controls. This is not a cure, but 54 months versus 15 months is a difference that transforms a man's relationship with his own disease. The traditional use: fresh pomegranate seeds consumed daily. Fresh pressed juice. The whole fruit as the ancient world consumed it at every meal where it was available. 11. Rye grass pollen, the field pollen that relaxes urinary obstruction. Quercetin, standardized rye grass pollen extract, produced from the pollen of several grass species including rye, timothy, and corngrass that grew across the ancient Near East and biblical world. And rye specifically, the grain that sustained populations when wheat failed, has been a component of Near Eastern agriculture and food culture throughout the biblical period. And here is what modern urology has found. Ryegrass pollen extract contains compounds that relax the smooth muscle of the bladder, neck, and urethra, reducing the urinary obstruction that makes urination difficult in BPH. It simultaneously reduces the prostatic inflammation that causes the feeling of incomplete bladder emptying. A systematic review of 4 randomized control trials found Quercetin significantly improved self-reported urinary symptoms, reduced nighttime urination frequency, and improved urinary flow in men with BPH. A separate long-term observational study found men using rye pollen extract maintained prostate symptom stability over years without progression to surgical intervention. The traditional use: rye pollen preparations used medicinally across the ancient world. Available today as standardized Quercetin extract. The grass pollen of the biblical grain fields was doing urological work that modern urology is now documenting in control trials. 12. Zinc-Rich Seeds, the mineral that every prostate requires. The prostate gland is the most zinc-concentrated organ in the male body. It contains zinc at concentrations 10 times higher than any other tissue. And zinc performs functions in the prostate that no other mineral replicates, including inhibition of 5-alpha reductase, regulation of androgen receptor sensitivity, and direct antimicrobial activity against the bacterial organisms that cause prostatitis. Sesame seeds appear throughout the biblical record. Sesame oil was used medicinally across the ancient Near East. Hemp seeds and pumpkin seeds were consumed across the biblical world. And all of these seeds are among the most zinc-dense plant foods available. And here's what modern urology says. Men with BPH and prostate cancer consistently show lower prostatic zinc concentrations than men with healthy prostates. A study published in the journal Prostate confirmed that zinc supplementation significantly reduced prostate cell proliferation and induced apoptosis in prostate cancer cell lines. Population research finds inverse associations between dietary zinc intake and prostate cancer risk in multiple large cohort studies. The traditional use: zinc-rich seeds consumed daily as food, sesame seeds, pumpkin seeds, and hemp seeds in the daily meal. The ancient world that scattered sesame into its bread and consumed pumpkin seeds as an ordinary food was maintaining prostatic zinc concentrations that the modern processed food diet systematically depletes. 13. African cherry. The African bark that reduces prostate enlargement. Pygeum africanum. The African cherry tree, used by healers across sub-Saharan Africa for what traditional medicine described as men who must visit the river many times each night. The ancient observation of nocturia, nighttime urination, as a specific male condition requiring specific plant medicine. And here is what modern urology has found. Phytosterols and pentacyclic triterpenoids in pygeum bark inhibit the growth factors, specifically IGF-1 and EGF, that drive prostate cell proliferation in BPH. They also reduce prostatic inflammation and improve the secretory function of the prostate gland. A Cochrane systematic review of 18 randomized controlled trials found pygeum bark extract significantly improved urinary symptom scores, peak urinary flow rate, and residual urine volume in men with BPH. The effect was comparable to Saw Palmetto in multiple head-to-head studies. The traditional use: pygeum bark decoction consumed daily as a tea, available as standardized bark extract. The African healing tradition that pointed healers to this bark across centuries of careful observation was using the same growth factor inhibition mechanism that modern urology is now studying in prostate cancer prevention research. 14. Ashwagandha. The adaptogenic root that regulates male hormones. Withania somnifera. Documented along the Silk Road routes connecting South Asia with the ancient Near Eastern world. And for male hormonal health specifically, ashwagandha addresses a mechanism that no other plant on this list touches. And here's what modern endocrinology says. Withanolides in ashwagandha reduce cortisol levels and simultaneously support healthy testosterone production. This hormonal relationship is critical for prostate health. Chronic stress elevates cortisol, which suppresses testosterone, which paradoxically increases the relative androgenic stimulation of the prostate through increased sensitivity to the testosterone that remains. By reducing cortisol and supporting testosterone balance, ashwagandha maintains the hormonal environment that protects the prostate. A randomized double-blind trial found ashwagandha supplementation significantly improved testosterone levels, sperm quality, and sexual function in infertile men. A separate clinical study confirmed significant cortisol reduction alongside improved hormonal markers in chronically stressed men over 8 weeks. The traditional use: ashwagandha root powder in warm milk at night. The ancient Silk Road healing tradition that prescribed this root for the depleted, stressed man was addressing the hormonal axis that modern endocrinology now measures with blood tests. 15. Pomegranate rind. The discarded peel that reduces PSA by 30%. Here we are at number 15, the one I told you about at the beginning. The Journal of Urology trial. The 30% PSA reduction. We have already met pomegranate fruit on this list. But the rind, the part that virtually everyone discards, contains punicalagins at concentrations 4 to 5 times higher than the juice or seeds. The most medicinally active component of the most medicinally active prostate fruit is the part the modern world throws away. And here is what the clinical trial confirmed. Men who consumed a pomegranate extract containing concentrated punicalagins from the whole fruit, including rind, experienced a 30% reduction in PSA levels after 12 months of daily use in a randomized trial published in the Journal of Urology. The reduction was most pronounced in men with the highest baseline PSA, the men with the most prostate inflammation and the highest cancer risk. 30% PSA reduction through food in 12 months, without side effects. The traditional use, pomegranate rind dried and steeped as tea, consumed daily as a potent preparation. The ancient Near Eastern world that consumed every part of every fruit it grew was consuming the highest concentration of punicalagins available in the pomegranate through the part that required the most preparation. 16. Beta-Sitosterol plants. The plant sterol that every prostate study points to. Beta-Sitosterol is a plant sterol found across many foods: avocado, pecans, saw palmetto, pumpkin seeds, and numerous other plants consumed throughout the ancient world. It is the compound most consistently identified across prostate research as the mechanistic foundation of multiple plants' anti-BPH effects. And here is what modern urology has confirmed. Beta-Sitosterol inhibits 5-alpha reductase, the DHT-producing enzyme. It reduces prostate cell proliferation. It inhibits the arachidonic acid inflammatory pathway in prostate tissue. And it blocks the binding of sex hormone-binding globulin to the prostate receptor, reducing the androgenic stimulation from that pathway simultaneously. A meta-analysis published in the British Journal of Urology International reviewed 4 randomized double-blind trials of beta-sitosterol and BPH and found significant improvements in urinary symptom scores and peak urinary flow in all studies. The effect was consistent and rapid in onset. The traditional use: whole foods containing beta-sitosterol consumed daily. Avocado, pumpkin seeds, pecans, sesame seeds, the foods of the ancient Mediterranean and Near Eastern world. The plant sterol present across dozens of plants the biblical world consumed was performing anti-androgenic prostate protection through every food it was present in. 17. Soy Isoflavones. The ancient East Asian legume that explains the prostate paradox. Men in Japan have prostate cancer at rates dramatically lower than men in the United States. When Japanese men emigrate to the United States and adopt a Western diet, their prostate cancer rates rise to match American men within 1 generation. It is not genetics. It is food. The primary dietary difference identified across decades of research is soy isoflavone consumption. Genistein and daidzein from soy and other legumes of the traditional East Asian and Near Eastern diet bind to estrogen receptors in prostate tissue with different effects from testosterone. They reduce the androgenic stimulation that drives prostate cell division while maintaining the anti-inflammatory and anti-proliferative effects of estrogen receptor beta activation. A meta-analysis of epidemiological studies found high soy consumption significantly associated with 26% lower risk of prostate cancer. Clinical trials confirm isoflavone supplementation reduces PSA levels and prostate cell proliferation markers in men with elevated PSA. The traditional use: fermented soy products including miso and tempeh for highest isoflavone bioavailability. Legumes daily across the ancient world's food culture. The isoflavone protection that explains the lowest prostate cancer rates on Earth was delivered through the fermented legume breakfast that the longest-lived populations have never stopped consuming. 18. Rosemary. The hillside herb that targets prostate inflammation. Rosemary grew wild across every hillside of the biblical Levant, consumed at every meal across entire lifetimes. And for prostate health specifically, rosemary's NRF2 activating and NF-kB inhibiting compounds address the chronic prostatic inflammation that is the foundation of both BPH progression and prostate cancer development. And here is what modern prostate research says. Carnosol and rosemary specifically inhibits androgen receptor expression in prostate cancer cells, reducing the receptor that DHT and testosterone use to stimulate prostate cell division. A study published in Carcinogenesis found carnosol significantly inhibited prostate cancer cell proliferation and invasion through this mechanism. Rosemary also inhibits the COX-2 enzyme in prostate tissue, reducing the prostaglandin production that drives the prostatic inflammation responsible for the pain and urinary symptoms of chronic prostatitis. The traditional use. Rosemary used generously in cooking at every meal, applied as a marinade to meat. The practice the ancient world maintained that was delivering carnosol to prostatic tissue through the most continuous available route. 19. Lycopene from cooked tomatoes and watermelon. The red food that concentrates in the prostate. We have already met lycopene on this list, but its concentration mechanism in prostate tissue is remarkable enough to revisit with the specific clinical evidence for the whole food form versus supplemental lycopene. The most important finding in lycopene prostate research is that the prostate gland actively concentrates lycopene from the bloodstream. It imports it selectively. This selective concentration suggests that the prostate requires lycopene for specific functions, and that lycopene deficiency in prostate tissue is a state the body tries to avoid. A landmark Harvard Health Professionals follow-up study found that men who consumed 2 or more servings of tomato sauce weekly had a 23% lower risk of prostate cancer compared to men who consumed less than 1 serving per month. Tomato sauce, slow-cooked tomatoes in olive oil, maximizes lycopene bioavailability through heat and fat simultaneously. The ancient Mediterranean world that slow-cooked its red plant foods in olive oil was optimizing lycopene extraction and absorption in ways that modern nutritional science has since confirmed are the most effective preparation method available. The traditional use. Red carotenoid-rich foods cooked slowly with olive oil, always with fat, always with heat for lycopene. The ancient food culture that did this daily was maintaining prostatic lycopene concentrations that protect prostate tissue from the oxidative DNA damage that initiates cancerous transformation. 20. The daily practice. The pattern that protected the prostate of the ancient world. And here we are at number 20. Psalm 92, verse 14. They will still bear fruit in old age. They will stay fresh and green. The biblical promise of vitality into old age was not passive. It was the observed outcome of a daily food culture built around specific plants, specific preparations, and specific habits that modern urology is now confirming were protecting the prostate at every level simultaneously. The Mediterranean dietary pattern, which is the dietary pattern of the biblical world, is the most consistently prostate-protective dietary pattern ever studied in nutritional urology. A large prospective study following over 14,000 men found those who most closely adhered to a Mediterranean dietary pattern had significantly lower rates of aggressive prostate cancer over a 12-year follow-up period. Not just any prostate cancer, specifically the aggressive, lethal form that kills. The plants on this list were not exotic supplements in the biblical world. They were the daily food. The seeds in the bread, the oil in the cooking pot, the herbs in every preparation, the red fruits at every meal, consumed continuously across entire lifetimes by men who stayed fresh and green into old age, because the food culture they maintained was protecting the organ that most determines the quality of male life in its second half. That food culture